Welcome to my work, the word of a medical laboratory scientist. Health is wealth, knowledge is power. Albumin and you. When I say albumin and you may not really understand what I'm trying to say. But ordinarily, you can understand without any question when I say the oxygen and you. Oxygen and you know oxygen is very essential, and without oxygen, there is no life. So when I say albumin and you, it's like I'm trying to tell you how important albumin is to you. And that is like I like trying to expose you to a deeper understanding of what constitutes albumin and where albumin is found in the body. The albumin is found in the bloodstream. It constitutes the liquid portion, the plasma of the bloodstream. You talk about serum albumin and stuff like that. The albumin is a very important protein, and when you are talking of it, you are now talking of the liquid parts of our blood stream. That watery part that really moves the blood and other nutrients to the different cells and tissues of the body. The protein of the bloodstream is made up of albumin and globulin. The globulin is the supporting aspect of the immune system, and the albumin plays the role of really transporting and maintaining osmotic pressure, what we call the oncotic pressure, that will not allow the water inside the blood vessel to go out. It more or less pulls water in, because it's the protein inside pulling water from outside inside the blood system, the blood vessels. Whereas the blood pressure on the other hand is the one pushing. It pushes the blood down to all the capillaries so that the nutrients and the oxygen and water can be supplied to all the cells of the body. The effort of the albumin is to maintain that volume in the blood stream, so that there is no leakage of that water out of the bloodstream, and the quantity goes that way. So you can then understand when we are now talking of albumin in urine. The albumin is the lighter part of that protein, the blood system. So when blood goes into the kidney, the glomerulus, like I explained the last time, it is filtered. So, but if the glomerulus is porous, the lighter protein, which is albumin, will leak out, and that's what forms the foamy urine. The foamy urine is a sign of glomerulonephritis or nephrotic syndrome. So the albumin plays a very important part in maintaining osmotic pressure, in transporting the various substances, ferritin, transferrin, and what have you, in the blood circulatory system. It plays so many roles that I shall expose in the slide section. But like I've always been saying, what is the role of medical laboratory scientists in this matter? It is the role of checking the albumin, that it is within the normal range. Once it is outside the normal range, it could be a sign of so many conditions, dysfunctions, and diseases. For example, I just mentioned the foamy urine. When the albumin is leaking out, then there is a problem. You now experience edema, because there will be no albumin in the bloodstream, or very few rather, albumin in the bloodstream. So there is that leakage of water outside the bloodstream, and you now see the person as very full of water. Edema is all over the body of such a person. And you also have situations where the albumin globulin ratio also indicates that there is a liver problem, that the liver is also getting damaged. So it's not only measuring the problem of the kidney, it's also telling you much about the problem of the liver, because the liver itself produces albumin, and when albumin is not enough, that or there is a leakage, then you start suspecting a liver problem. So other liver function tests that you do, coupled with the ratio, you'll be able to now diagnose that there is a liver problem going on. Probably it's just the early stage, and it can be nipped in the bud. So the role of the medical laboratory scientist is to take these measures, to measure all these parameters that I shall expose more in the slide session. And like I've always been saying, click like and subscribe for more. The outline: objective, introduction, implications, laboratory diagnosis, and conclusion. The objective: to create more awareness of the role of albumin in sustaining life, increased longevity, and the need to routinely check for any derangement in its values to avoid health conditions associated with its derangement. The introduction: any living person has blood in his vein or a vein, which has two main parts, the Park cells and the plasma. Albumin is contained in the clotted blood plasma. The serum albumin is produced by the liver in large quantity and is the most abundant blood protein in mammals. Serum albumin can adapt their conformation effectively, binding and transporting multiple molecules such as metabolites, nutrients, and drugs, as exposed in the diagram. Albumin is essential for maintaining the oncotic pressure needed for proper distribution of body fluids between blood vessels and body tissues. Without albumin, the high pressure in the blood vessels will force more fluid out into the tissue. It also acts as a plasma carrier by non-specifically binding several hydrophobic steroid hormones and as a transport protein for amines and fatty acid. When you talk of also ferritins and co-transferrin, too much or too little circulating serum albumin may be harmful as an anionic protein. Albumin also binds readily to calcium in blood serum and contribute greatly to plasma calcium levels. Now let's look at the implications of where there is a derangement, where it is impossible for this performance of its function for albumin. So number one, its core essence lies in maintaining stable blood pressure and safely distributing essential nutrients, hormones, and medications throughout the bloodstream. So where there is a derangement, low level of it, one could then start thinking of high blood pressure and also the effectiveness of drugs that we take, since the albumin will not be able to transport it to reach the place of activity where it is most necessarily needed. Then two, it also prevents swelling. By that we mean because the molecules are too large to easily leak through vessel walls, albumin keeps fluid from seeping into surrounding tissue, preventing conditions like edema, the swelling as earlier exposed, or fluid buildup in the lungs. Three, the implication is also it is water soluble, so it binds to substances that cannot dissolve in water, ferrying them to where they are needed, just exactly like the
Example 2, the number 2, hormones generally and cortisol that are fatty in nature. Fatty acid and fat-soluble vitamins, minerals such as calcium and magnesium are carried swiftly to the point of need, and where you don't have them, then you can understand that the deficiency of these things has the implications in causing different diseases as well. The medication delivery, it binds to various therapeutic drugs, like for example warfarin, regulating how much of the medication is actively working in your system at any given time. So we must not play with albumin, because it is very useful in allowing all that we take, the drug and the hormones, all of them to be effective, because it delivers them in the right proportion, right concentration. Still talking about the implication, number 4, albumin helps neutralize harmful free radicals. We know that radicals cause cellular damage and inflammation. So when you do not have albumin, you can understand that aging and even other chronic disease of old age, including cancer, may become that person's portion. It's also a waste remover. It binds to toxin and waste products like bilirubin, safely delivering them to the liver and kidney for excretion from the body. So where the albumin is not adequate, obviously you expect that this toxic substance could start damaging even the liver and the kidney. 5, during period of high metabolic demand, starvation or severe illness, the body can break down albumin to use its amino acid for tissue growth and repair. So that in a nutshell tells us that it could also help prevent malnutrition, acute malnutrition from taking place. But when it is now exhausted, used up, then you can start thinking of marasmus and kwashiorkor, which also has its various complications of additional diseases. Now the patient harboring more diseases. The clinical significance of albumin level, typically measured between 3.4 and 5, serve as a sensitive for liver and kidney health. Laboratory diagnosis just involve using the blood sample or urine samples and performing the test, knowing the normal values, so that when there is a diminution from normal values, the implication is that with normal range in blood of 3.5 to 5.5, the low albumin indicates impaired liver production. That is, the liver, since it produces this albumin, maybe there are issues, underlying condition that is preventing it, like liver cirrhosis, hepatitis. And when there is excess protein loss, then through the kidney you have nephrotic syndrome. Severe burns also causes this problem of low albumin and malnutrition. High albumin usually has that situation of dehydration or acute hypertension. Now, finally, conclusion. Many chronic non-communicable diseases occur at old age because their early detection rather impossible. But with albumin knowledge now, testing at age 40 or 50 routinely should be encouraged. One may discover the early stage of kidney disease or liver disease as per the values you get. It should therefore become a necessary screening test for kidney disease and liver disease as we age, especially using the albumin globulin ratio, which, if high, high, that ratio when it's high, it shows that you are having more albumin and very less globulin. And since we know that globulin is involved in this antibody production, immunity, and all the things that would help prevent diseases, then one should know that the one is immunocompromised in a way and would need to find a way of boosting up the globulin to increase, so that the problem of associated with low immunity will not be there. The low level of albumin indicates liver cirrhosis, because the liver, once it has that cirrhosis, it will not be able to produce enough albumin, or nephrotic syndrome when it is leaking out. So you will not have enough in the blood. Albumin derangement, especially hypoalbuminuria, is associated with a higher risk of hypertension. So routine check may be necessary for hypertensive patients. So where you now find that you have hypoalbuminemia, you can then correct it and probably also solve the hypertension problem. You have many videos on this channel. Just scroll to you, it will be, and please subscribe so that more production may come.